everyone. Welcome to our Facebook Live session. We love Nogales. This is hosted by Mariposa Community Health Center in an effort to provide really cool health information that could help our lives better. So I want to welcome all of you to our evening tonight. We have a special session tonight. We want to talk about topics that are frequently not discussed at the dinner table, but they can impact lives in many, many ways. We saw that in the 80s when we have the HIV epidemic, and we still see some of that. And we hope that our session tonight gives you a glimpse as to how, in many cases, our choices may have significant consequences in our lives, mostly in terms of infections that we can acquire via sex and our behaviors, from HIV to hepatitis C, gonorrhea, chlamydia, syphilis, and others. So we hope we have a good time discussing this. We'll see how it goes. We want to make it a conversation, or maybe an educational session with the students. I do have two distinguished guests with me, and I'm going to let them introduce themselves, what they do for Mariposa, their role, and more importantly, what program they participate, and then we'll begin with the questions. So welcome.
Thank you for having us. So I'm Zavala. I work at Mariposa Community Health Center. My division or department is Community Health Services. And the program that I teach or facilitate is Making Proud Choices. I'm an education facilitator, which is just me teaching students around the ages 11 through 19 about HIV and teen pregnancy risk and kind of like helping them reduce it.
Great. We're going to spend a lot of time on that. We're going to talk about HIV, we're going to talk about screening, we're going to talk about prevention, we're going to talk about condom use, pregnancy, all of that, right? So, great.
Hi, hola, mi nombre es Giannyn Fabian. Trabajamos en el departamento de Community Health Services aquí en la clínica Mariposa. Somos Education Facilitators, trabajamos con jóvenes dentro de la edad de 11 a 19 años. Básicamente para prevenir el VIH y los embarazos en adolescentes.
Muy bien, muy bien. So esta noche vamos a hacer una sesión muy productiva donde vamos a hablar de temas que a veces son un poquito fuertes, pero son muy importantes, porque estamos hablando de la salud reproductiva, en muchas ocasiones de la mujer. Estamos hablando de enfermedades que afectan la vida de todos nosotros, y si esta sesión puede evitar una infección, yo creo que hemos hecho nuestro trabajo. So, a ver cómo nos va esta noche. So, welcome. Vamos a ver cómo nos va. So, platícanos de tu programa. ¿Cuál es el propósito? ¿Qué tipo de adolescentes queremos ver? ¿Cuál es el impacto que queremos tener? Y qué tipo de resultados queremos obtener. Y luego vamos a cubrir los módulos que enseñan, y cuando hagas eso yo voy a hacer unos comentarios clínicos acerca de lo que es importante para un doctor y para el paciente saber en el cuarto de examen. So, hablamos del programa y qué podemos hacer para proveer este servicio. ¿Okay?
So the program that I'm in charge of is Making Proud Choices. Like I mentioned before, it's to reduce HIV and pregnancy amongst adolescents. The range that we work with is 11 through 19. Female, males, any background is welcome as long as they're at that age group specifically. And we do a lot of activities in this. We try to do a lot of stuff to empower them, to make better decisions, to see what are the right choices for them in their lifestyle, because we know that obstacles occur in normal lives, and HIV and pregnancy can become an obstacle. And even though we don't, how do I explain it? So a lot of people can kind of power through those obstacles, but we just don't want our students, teens, to go through that. So we give them these tools, skills to talk to their partners, use condoms, have better knowledge of what HIV is, what other STDs are, how to prevent pregnancy, and just be safer overall. So that's pretty much our goal. We try to just empower them, teach them tools. I know that a lot of kids that I end up seeing, they say that they're not sexually active. They think they don't need it at this certain time in their lives, and that's understandable because we do try to practice abstinence, tell them that abstinence is something that they could do, but also this is tools that they can use later on in their life that might be necessary when things come up. So we just want to prepare them, even though 11, like I mentioned, seems like a very, very young age. I know a lot of people get startled when I say that age, but I think it's important just to kind of get it early on, teach kids early on about this, because once it comes in the moment, a lot of things they forget. They don't know how to take control of that situation, so it's just good to have that in mind at that point.
And in terms of HIV, it's a lot better to prevent HIV than to treat it. Once we diagnose HIV, the treatment will be lifelong. It would be pills for the rest of their lives. And it carries all kinds of issues for them in terms of relationships, in terms of pregnancy, in terms of medical care for the rest of their lives. So this is something we want to prevent by addressing behaviors. And we'll talk a little bit about medication, which can be used in certain populations. I don't want to give the impression that medication is the only choice, but rather the choices we make is what makes an impact. So I think we'll talk about that. So tell us a little bit about the modules that you cover, and then we'll review a few other things.
So this program is 8 modules, so technically 8 hours. I know it's a bit long, but all of these are crucial to be taught together, because this is evidence-based. It's very effective when it's taught together. Okay. So I'll start off with Module 1. Module 1 is just kind of introducing ourselves, being familiar with each other, because we're trying to make our space very safe, a safe space. Everything's confidential, building trust. So that's very important. Okay. Along with that, we start talking about goals and dreams to kind of set a foundation for them to feel motivated and empowered to protect themselves. And that's when we talk about obstacles, like obstacles to those goals, which can be HIV and pregnancy, as well as like attitudes, like why are people their ages having sex? So we try to kind of think about those things that are happening in their lives at the moment. Okay. And then Module 2, that's when we talk about HIV. So when we're talking about HIV, I explain what HIV is, how it's transmitted, how it's not transmitted, symptoms, if there's even symptoms, how to get tested, like what do they look for in tests. So that's what we kind of talk about. We do this like risk continuum, which is kind of after we teach them this, we do a bunch of activities where they kind of differentiate what is actually a high risk, which is just what is a high risk of getting HIV, and which is like a low risk, which is like not really possible of getting HIV. And then for Module 3, we do attitudes about sex, HIV, and condom use. So this is more about their personal beliefs and their personal attitudes towards these type of concepts. So it's like myths and facts, what they've heard, what they haven't heard about HIV, just pretty much this, like disagree and agree about certain topics, and we kind of just try to break down misunderstandings or anything like that throughout these points.
Very good. So let me stop here for a moment and talk a little bit about HIV. I mentioned earlier that it's best to prevent HIV, right, than to treat. Having said that, there are some recommendations by various societies that tells us when to screen. So screening is recommended in the U.S. Typically ages either 13 through 64 or 15 through 65. we as physicians don't need necessarily a reason to do it. We just do it based on the age alone. I think patients who have concerns about their sexual behaviors may want to have the test done more often. At the moment, it's a one-time test. But if there are issues that the patient has confronted, we can do it more often. In the past, we've had patients who we do it every 6 months, we do it every year, or we do it a few weeks after a possible exposure. So when we talk about screening, by the way, screening, we talk about getting a test when there are no symptoms, right? So we can talk a little bit about acute HIV in just a moment, because acute HIV can be confused with other illnesses that we see in the office, from infectious mononucleosis to a sore throat and all of that. And we'll talk a little bit about the kind of tests that we do. But I want to make sure that people know that screening is recommended for late adolescents and adults as a one-time test, unless certain behaviors suggest that the doctors needs to do it more often. We want the test to be negative, obviously. If it's positive, then we begin a series of tests to determine a number of things, such as genotype, such as resistance, and choose the right drug. So I want to make sure that our audience knows that there's screening in the absence of symptoms, but that your program emphasizes the need for prevention. And we'll talk not just about HIV. Whenever you prevent HIV, you're actually preventing other infections. And we'll talk a little bit about hepatitis C. We'll talk about syphilis. We'll talk about gonorrhea. We'll talk about chlamydia. And we'll talk about herpes simplex virus. So we'll expand on that. So let's move on to the other modules in terms of what you do.
And then for module 4, we do stop, think, and act, which is very crucial in the part of having a relationship and communication with your partner. So we talk about sometimes a person might not be ready to have sex. So this is kind of a tool that they can use for that. Like they stop to, like why would they need to stop? How can they control their breathing if the situation is being pressured or too scared? Thinking is like, why are they stopping? Like thinking what they're doing in the situation. Like, what are my options? Why am I doing this? Why do I feel pressure? Why do I feel uncomfortable? So that's what we're talking about when thinking. And then act is like acting upon those thoughts. So if you're feeling pressured, you're uncomfortable, and you think, oh, maybe my options is just to leave the situation or talk it out with my partner, act upon that. Like acting on, like, let's actually talk about this to your partner. Or you know what, let's say I don't feel comfortable with this, let's just do another activity. Let's go watch a movie, let's go have dinner, something like that. So that's what stop, think, and act is. And then they kind of practice that. After me explaining that, they practice it, they watch videos that kind of demonstrate that. They try to see if the person in the video actually did stop, think, and act.
Right. So what kind of response do you get from the students? Is that something that is difficult to accept? How do they feel about all the having to, in the moment, having to think about this, having to stop? What do you see in terms of the response? Is it something that's doable, that's effective? Tell me about your experience as you teach this.
So the experiences do depend on like how old they are,
Okay.
but for the most part, they do know like what to do in the situation,
Okay.
but they do think it's difficult to do the act part. So they do like, yes, I know that they're supposed to stop, like the things that they're supposed to do when stopping. When thinking, they tell me like, oh, they're probably super scared, they're uncomfortable, but acting, they sometimes don't know what to do. They're like, just leave the situation, like just leave. And that's I totally understand that, but we try to make it seem like maybe have communication with your partner, not just leave the situation totally, because this is something that you have to practice, or you should practice every time you have a partner, about talking about what you're comfortable with, what you're accepting in your relationship, what you don't want to accept, talking about condoms, or you just do not want to have sex. We try to push more of that direction, because we are trying to teach them that, than just, even though just leaving a situation is totally valid, we try to go back and forth to these type of situations.
And I suspect you teach the consequences of not doing that, right? So the consequences can be very serious. An acute HIV infection. We'll talk a little bit about sexually transmitted infections and the long-term consequences, and of course pregnancy.
Yes.
And we'll talk a little bit about Truvada, which is the medication that we have available to prevent HIV infection, but the reality is that this drug does not prevent pregnancy, and it does not prevent other sexual transmitted infections. So think about the consequences of that moment. Maybe a sort of an alert sign that it's time to reassess, right, the way we do things. So that's great. That's fantastic. I think that's so cool that you're doing that. Okay. All right, Module 5.
So Module 5, that's when we start talking about other STDs. So we talk about gonorrhea, syphilis, chlamydia. We do talk about a bit of the symptoms, if there are symptoms. We also talk about like long-term effects to these diseases and illnesses, as well as we talk about some attitudes about STDs as well, and other myths and facts about STDs.
So STDs are on the rise. We know that many sexually transmitted infections are increasing in both incidence and prevalence, which is unfortunate, but it is what it is. So it's, the importance is to recognize. And I will take a moment, if I may, to talk a little bit about that. You mentioned gonorrhea.
Yes.
And gonorrhea is a bacterial infection that infects the urethra of men and infects the urethra and the cervix in women. In men, it tends to cause pain upon urination and a discharge in the urethra or pus. In women, tends to cause a vaginal discharge. That usually will bring the patient to the attention of the doctor. And once the diagnosis is made, and in men it's typically either made by looking at the gram stain of the discharge, or we can do a DNA test or nucleic acid amplification test or NAT of the urine, and that's an easy test to do. In women, it does require vaginal swab. It's a DNA test as well. But the diagnosis can be readily done with gonorrhea, for gonorrhea, and treatment is very effective. The problem with gonorrhea is that we're seeing an increased risk of resistance to antibiotics, and that's a problem. At the moment, we have a number of medications that are very effective, including ceftriaxone, which we can do in the office. But the bacteria tends to evolve, tends to change, and resistance patterns have been seen in Southeast Asia, Indonesia, Thailand, and so on. So that's an issue. And of course, gonorrhea can be transmitted via sex. I'll talk about the other ones. Before I do that, I'd like to talk about chlamydia. Chlamydia has a different problem. So chlamydia tends to cause discharge as well. We do screen women for both GC and chlamydia. We don't screen men because typically men have more symptoms, so they'll come to the attention of the doctor. Chlamydia does have symptoms of discharge as well. The problem with chlamydia is that it tends to ascend to the organs in women, and it will cause infection of the fallopian tubes. And that could lead to pelvic inflammatory disease, commonly referred to as PID, or long-term scar tissue and infertility. So it could be an issue in terms of reproductive health. We do have effective treatment for chlamydia. We do use either azithromycin or doxycycline. But those are the two common ones. In women, we do screen for them, typically in sexually active women, 25 and over. In men, we don't, but we see them when they're symptomatic. There are other STIs that I'll talk about, such as syphilis, herpes simplex, and a few others, but I'll let you cover the other modules. But I want to make sure we talk a little bit about the fact that while these infections have treatment, there are significant consequences on reproductive health, particularly for the woman. So, but we'll touch on the other ones in just a moment. So we'll go over the other modules.
So for module 6, we talk about consequences of sex, such as pregnancy. So we talk about birth control methods. So we go over a bunch of birth control methods, like the pill, the patch, the implant, kind of break down like how you should take it, where you get it. Many of them are prescribed by your doctor, and we talk about like unprescribed methods, which is like condoms, a sponge, and other contraceptives, as well as we talk about myths and facts about pregnancy. And this is a really interesting one because a lot of people have all these misunderstandings that when I tell them a certain statement, they think it's true when it's not, or when they think it's true, or quite the opposite as well. So it's a really good activity for them to actually know what's true and what's really not, as well as we start talking about what they think about pregnancy. So we do this activity called agree and disagree. So, and this is all their opinion based belief, and I try to have them be as comfortable and as truthful in this activity, so I can hear their side of the story, and if there's any misunderstanding, because that's what may happen, I can clarify those type of things in that activity. Okay. So that's what we do there.
We want to prevent pregnancy, unintended pregnancies. Certainly, the issue with pregnancy is not just pregnancy, but there will be other STIs that could affect pregnancy. And that's something that we sometimes don't think about. So for instance, herpes simplex is a virus transmitted by sexual intercourse. It tends to have a prodrome or symptoms before the skin lesions appear. It tends to cause pain, numbness, tingling of the genital area. I'm referring mostly to herpes simplex virus 2. Herpes simplex virus 1 is the one that tends to cause the sores in the mouth. But 2 is the one that tends to cause genital infection, although 2 can cause mouth sores too. And then following that prodrome, you'll have these blisters that are very, very painful. We can make the diagnosis by doing what we call a PCR, polymerase chain reaction, which is an easy test. We swab it, we send it for DNA, and we'll have a diagnosis. The problem is in pregnancy is that if you are entering into late pregnancy and you have active herpes lesions, a C-section is recommended. And the reason is that as the child goes through the birth canal, they can be infected by the active herpetic lesions, and the child can develop a very severe infection related to herpes virus. So that's a consequence of pregnancy, that instead of having a vaginal delivery, if you have active lesions, perhaps a C-section might be indicated. Now, there are some recommendations by certain groups that do recommend a cyclovir in pregnancy to reduce the risk. But still, it's an issue that the doctors will have to deal with at the time. So that's one example how pregnancy and STIs are linked. The other one is syphilis. Syphilis is a bacterial infection caused by a bacteria called Treponema pallidum, and it's an infection that is transmitted by sex. Typically, there are 3 stages: primary syphilis, secondary syphilis, and tertiary syphilis. Primary syphilis is manifested by an ulcer that is typically painless at the site of exposure. So that could be the genital area, it could be the mouth, and over time it heals. It goes away on its own. If we see someone with a painless chancre, which is what we call it, we will do a test and treat it as such. And usually it's easily treated with a medication called benzathine penicillin, one shot, and that's it. The problem with that is that we need to figure out the exposure to other partners. We have to go back, typically at the last 90 days, and see who that person was with. Try to track that and identify and treat partners. So that's primary syphilis. Secondary syphilis is the disseminated stage where the bacteria leaves the area and goes to the blood. And then it can infect a number of organs, including the skin. And we typically see a classic rash that is not painful, but about 50% of the time infects the palms and the soles. And that's very classic for syphilis. Sometimes the bones could be affected, the liver could be affected, and even the brain. And we call that early neurosyphilis or syphilitic meningitis. And then the third stage is over the years, untreated syphilis. It can affect the brain, it can affect the heart, and you see aortic aneurysms. The reason I go through all of that is that we're seeing an increased number of babies being born with congenital syphilis. And those are typically women who had the infection, it was not recognized, and now the baby is born with congenital syphilis. And the pediatricians sometimes will have a clue based on certain features of the face, the teeth, and sometimes a blood test. So I wanted to link the pregnancy to the STIs. And we can do that with the other infections. We can do that not just with syphilis and herpes, we can do that with HIV infection, and we can do that with the others. So I just wanted to make a point that yes, we want to prevent pregnancy, but it's about sexually transmitted infections. It's about how we recognize and we treat them. And it's really important that our audience can recognize that, having sex is a big deal. And we certainly could be acquiring those infections when we don't need to, right? Mm-hmm. Absolutely. Okay, very good. So, excellent. Very good. Condoms.
Yes. So we do develop condom use and negotiating skills. Mm-hmm. So by this point, they learned, or I taught them how to put on a condom correctly. Okay. Because many of them think they know, or they just because they think that they just put on a condom, it should work. But they don't know that there's a lot of little factors that might cause a condom not to be 100%. Because if you use a condom correctly, it's very effective. But things like being exposed to heat for a long time, or putting in a pocket where it can potentially rip or not open it correctly, a condom not having enough lubrication, those are just factors that are just making it potentially not be as effective if you actually did those steps correctly. So at this point, I taught them this. And then we were talking about, okay, you guys got a bit more comfortable being around condoms, touching them, putting them on. Now it's actually talking about condoms. So talking to their partners, with I encourage them that we're exercising to talk to partners, but also to potentially talk to their parents about it as well. They're using condoms every time they have sex. Even negotiating skills, meaning that sometimes a partner might be very stubborn that doesn't want to use a condom due to reasons. So we start thinking about how to respond to those excuses. Like some are like, condoms are too expensive. I don't have any. So we try to like come up with solutions like, okay, let's go to the clinic. They have free condoms there. Or you don't have a condom, then I have a condom, because I always encourage them to carry a condom regardless if they're male, female. It's always good to use a condom if you're sexually active. So those are just things that we start talking about throughout this module.
So a quick reminder that condoms are less expensive than pregnancy, right? So I think that's something to think about. Also a quick reminder that condoms ought to be used 100% of the time, not occasionally, because that would be the time that something would happen, right? Yes. It has to be 100% of the time. So, and we'll talk a little bit about HIV prevention with Truvada, but condoms is recommended as well. So it's not just taking the pill, it's also taking proper steps to enhance protection, not just against HIV, but also against other STIs as well. So condom use, right?
Yes.
Excellent. All right. And the other modules?
And then the last module, which is module 8, is just kind of expanding on what we already talked about. We already talked about how to come up with responses to excuses, so now we do role playing. So I tell them that they might feel uncomfortable because we try to make real situations. We give them a prompt where they have to talk to their partner about condoms, and they might feel awkward. There's like students sometimes that don't know each other and they do this exercise, but I tell them that's very important, because if they don't know what to do in the situation, if they feel awkward in the situation, it's going to be tougher when the actual moment starts. So it's better to kind of be prepared beforehand, kind of know your points, what you kind of want to tell your partner about. So it's like listing why you want to use a condom, like either like I have goals, I don't want these type of obstacles in my life, it's to be safer, I don't want to get an STD, I don't want you to become pregnant, I don't want to become pregnant. So we start doing these role plays, and they get very creative, and they do have a lot of fun coming up with these different scenarios. And like I mentioned before, I try to tell them that they should stay in a relationship, because for the most part people when they're in a relationship, we want to be with each other. So like I said before, it is an option, and it's totally valid to leave a relationship when you should. But also to exercise that, we try to just have them practice like they want to keep their relationship and actually talk to their partner, not just say, okay, you don't want to, bye. Because it's just important to have this communication with your partner every single time.
That's excellent, that's excellent. So estamos hablando del uso de condones y la importancia de protegerse, ¿no?, contra el embarazo y las enfermedades transmitidas sexualmente. ¿Algunos otros comentarios? Giannyn.
Pues básicamente los jóvenes cuando llegan a la clase a veces no quieren hablar, depende de la edad que tengan.
Okay.
O muchos vienen con la idea de que ya sabemos, o mis amigos me dijeron esto, y muchas veces agarran la información incorrecta. Entonces para eso estamos nosotros, para darle la información adecuada y empoderarlos para que usen el condón. Y el condón pues los protege de un embarazo y de enfermedades transmitidas sexualmente. Son dos cosas ahí, luego pueden usarlo.
¿Qué piensas? ¿Cuál es la barrera más importante en esa edad? ¿Tú crees que es falta de información, aceptando la información, el momento en que llega el acto sexual? ¿Cuáles son las barreras que tú ves en esta edad?
En esta edad puede ser la falta de información, ya sea de que no preguntan y les dicen, agarran la información incorrecta de los amigos, no le preguntan a la persona adecuada, ya sea a su doctor, porque les da vergüenza para todo, a un adulto, ¿no? De que, ay, no me van a regañar, y igual de la comunicación que tengan en pareja, porque muchas veces, no, es que no quiero porque o me va a dejar si son novios, y les digo, pues solo basta una sola vez que tengan relaciones sexuales para que salgan embarazadas o de que contraigan una infección. Entonces, la comunicación es fundamental, digo, en esta relación que tengan.
Y las consecuencias son de por vida.
Exactamente.
Ese
Sí, porque cuando hablamos, por ejemplo, de las enfermedades transmitidas sexualmente, pues dicen, no, es que están las curables, ¿no? Porque dicen, hay unas que se curan, pero como usted dice, el cuerpo ya se hace resistente al volverla a contraer, pues ya el medicamento no puede ser que no resista o les haya infectado una parte de su cuerpo.
Claro. Y hay enfermedades que son tratables, pero no son curables.
Correcto.
En este momento, la enfermedad de VIH es tratable, pero no curable. En general, aquí han habido 1 o 2 casos donde se piensa que ha sido, pero en general asumimos que hay que tomar medicina de por vida.
Exactamente.
Ahorita vamos a hablar de hepatitis C, acerca de eso. Y la realidad es que a menos que no haya síntomas, a veces estas enfermedades no se reconocen. Sífilis, a veces tienes una úlcera, la ignoras, y en unas semanas tienes sífilis secundaria, luego terciaria, y luego 30 años después, el diagnóstico se hace a través de la prueba de sangre. A veces no es tan fácil como parece.
Exactamente.
Usando condones, usando la protección y, como dices, tener una buena habilidad de negociación para hacerlo en el momento apropiado y con la protección apropiada.
Sí.
Cuando se esté listo, ¿no?
Sí, pero como usted dijo, una vez, por ejemplo, le llega a uno con una infección y como dijo, te tienes que ir 90 días con sífilis para ver con quién fue que tuviste relaciones en ese momento y luego decirle a la persona, ¿sabes qué? Me contagiaste con sífilis. Y en ese transcurso pudiste haber tenido relaciones con otra persona, entonces ahí va el riesgo otra vez y así se va subiendo los números.
Y esa conversación es muy difícil, muy difícil. Por eso es importante tener una buena relación con tu doctor, donde puedas compartir esas inquietudes, puedas compartir esos comportamientos que haces para ver no solamente cuáles son las pruebas necesarias, pero las medicinas que son apropiadas para evitar estas enfermedades, ¿no?
Correcto, sí. Como les digo también a las jovencitas, vayan con su ginecóloga, platiquen con ella, cualquier pregunta que tengan, ella es la más adecuada de contestársela, ya sea si se quieren cuidar con anticonceptivos, ella es la que le va a decir cuál es el adecuado. O sea, no tomen consejos de sus amigas ni nadie más, sino de la ginecóloga.
Claro. Y evalúan también, depende de la edad, depende de todo, se hacen la prueba del cáncer, se dan las medicinas apropiadas y se hace el screening necesario para enfermedades sexuales. Eso es una visita muy productiva.
Sí.
Y después de esa visita, el doctor evalúa y decide cuál es la frecuencia de esas visitas con el doctor. Muy bien, muy bien. Vamos a hablar en el último segmento, nos quedan unos 5 minutos más o menos, o 10 minutos. Vamos a dar de Truvada, de PrEP. Se llama Pre-Exposure Prophylaxis. So this is a medication that we use to prevent an acute HIV infection. It's very effective. There are 2 medications in one, and the names don't matter too much. There's one called tenofovir, the other one's called entrisarabine, but the names don't matter. It's 1 pill a day. It can be taken with or without food. It's very effective. Effectiveness in terms of HIV prevention is over 90% when taken every day. The problem is sometimes that we don't take it every day, and so the efficacy drops significantly in some cases. Now, it's not a medication that needs to be used on everyone. So we look at typically 3 groups of people that would benefit from this drug. So the first one is men who have sex with men. That's a group that we want to target. In fact, we want to prevent not just HIV, but we want to prevent syphilis. If you look at the population that has been struck by rising syphilis, is that one, men who have sex with men. The second group that Truvada may benefit is the group that is heterosexual but carry out high-risk behavior. So that would be someone, for example, who has sex with commercial sex workers, or perhaps an HIV negative person having sex with an HIV positive person. There's a name for that. We call that discordant couple. So that would be in which a member of the couple is negative and the other one is positive, but they're together and they want to prevent transmissibility. And Truvada is effective for that. And the third group are patients who use IV drugs. And we know that HIV is transmitted not just by sex, but also by exposure to body fluids. And of course, blood is a body fluid. So those are the three. When we prescribe Truvada, we want to check a few things. First, we want to have a negative HIV test. So this is a prevention drug. It's not a treatment drug necessarily. So you want to have a test that is negative, typically within a week of starting the drug. And then we also order some other blood tests to make sure that the kidney function is normal. The drug may have an effect on bone health, so that's something that the doctor will have to discuss. But it's very effective. Studies have shown that the drug can be taken indefinitely. There have been studies up to about 5 years, and there are no significant issues. So that's very important. It is critical that the patient be seen by the physician in the office every 3 months. For various things. First, it's another HIV test. Because then, if the patient converts to an HIV positive situation, then it's not about prevention anymore, it's about treatment. And the clinical scenario changes. We also need to monitor the renal function. I want to underscore what you said about condom use. So Truvada is effective. But we do recommend that condoms be used as well in order to prevent acquisition of other drugs. I think pregnancy prevention is equally important as well. So we don't want to rely just on drugs, right? It's mostly about behaviors. But in certain situations where the risk is particularly high, that's where the medication comes in. Once you begin medication, the protection is not immediate. So depending on various factors, we typically see protection starting around day 7. And it could take as long as 20 days. So we would recommend that the patient not engage in those behaviors until 2 or 3 weeks typically. After the medication is started. Having said that, it's not 100%, right? So there's always a potential for an acute HIV infection, and that will be another topic for another day. But it's really important to recognize that acute HIV can present with a rash. It looks like a sore throat, an infectious mononucleosis syndrome. And that we do have a test that can be done. We do what we call a 4th generation HIV test, and we check for the antibody and something called the P24 antigen. And then in that test, we do our RNA. And at the moment, the technology is such that we can diagnose HIV within 10 days of getting the infection. Once we diagnose the infection, we begin treatment right away on everyone. So in the old days, we used to wait based on CD4 counts. We realized that's not the way we want to do it anymore. In fact, we begin treatment as soon as we make the diagnosis. We do other blood tests. But we do know that the outcomes are best once the treatment is begun. And treatment is for life. Depending on the drugs, either once a day or twice a day, the doctor will monitor various blood tests. but we want to reach a situation where the viral load is undetectable and remains undetectable. And finally, my last comment for tonight about hepatitis C, which is another virus that can be transmitted via sex or blood products. The recommendation at the moment is to do a screening test with an antibody test followed by reflex RNA for everyone born between 1945 or 1965 as a screening test. Now, we can do an HIV test, hepatitis C test for other reasons, right? Fatigue, elevated liver test, there may be other reasons. But as a screening test, just your year of birth is enough to do the test. So I think we cover a lot, right? So in summary, we talk about the modules you do cover in your class. We've spoken about prevention of HIV, acute HIV infection, PrEP with Truvada, and the importance of condom use, birth control use, and pregnancy prevention. I think we cover a lot of information. I hope that our audience benefits from this information. It's really important to contact their doctor for follow-up, any issues regarding symptoms, or any kind of STD screening. So we're going to end the session by you telling us about how to contact the program, how to register, and all of that. And I think that would be it for tonight. So go ahead.
Yes. So definitivamente los queremos invitar a los padres, si ustedes no quieren hablar con sus hijos sobre estos temas, pueden mandarlos aquí con nosotras. Estamos en Community Health Services Downtown, donde está el Circle K por la línea. A 15 días estamos en el edificio. Vamos a tener clases el lunes y martes que vienen de la próxima semana, 23 y 24, de 3:30 a 7:45 los 2 días.
¿Y cómo se matriculan? ¿Tienen que llamar o se pueden presentar?
Pueden llamarnos al 520-375-6050.
Repítalo una vez más.
520-375-6050, extensión 1363.
Perfecto.
Y ocupamos que ustedes nos firmen un consentimiento. So, ya sea que puede hablarnos, que lo mandamos por correo, o ese mismo día puede venir con su hijo o hija y lo puede firmarlo aquí mismo, ¿no? Antes de dar la clase.
Muy bien. ¿Alguna otra información que quieran compartir con nosotros? We're good?
I'm just going to repeat everything because we have, like Giannyn said, we do have upcoming classes Monday and Tuesday, September 23rd and 24th from 3:30 to 7:45. And please attend both days because like we recapped it, everything's very important. As well as we have a weekend session, which is Saturday, September 28th and Sunday, September 29th from 10 a.m. to 2:15. All I need is a permission slip from the parents because everything's confidential. That's the reason why we're asking for a permission slip. They can either contact me through the phone number 520-375-6050, and my extension is 1363. I can either email you the information or come into my office, which is CHS Downtown. It's where across from Circle K where the Foxworth building is. Or the day that you come to the session, we can fill out the permission slips there as well.
And we hope that the parents give us permission. This is about their lives, the children's lives, right? And it could be life, absolutely. So I'm going to look at Edgardo and tell us, Edgardo, if we have any pressing questions, if we have any fabulous comments that people have made of our presentation today.
Yes, tenemos a Ivette Clarisa Figueroa, thank you, Dr. Pereira. También tenemos a nuestra compañera Conchita Somoza.
Okay.
Felicidades, compañeras, muy buena información.
Okay.
Sigan adelante. También a Tatiana Enríquez.
Okay.
Prevention is better than cure.
Okay. Muy bien.
Yolanda Silva Pereira, creo que la conoce.
Sí, así es.
Excellent topic, dice.
Okay.
También creo que también la conoce Carmen Alvarado.
Ajá.
Está viendo bendiciones para mi querido hijo, muy interesante.
Muy bien, ok, perfecto. So, los comentarios fueron estupendos. Muy bien, pues muchas gracias por acompañarnos esta noche. Gracias a nuestros invitados. Esperemos que esto sea de utilidad. Y buenas noches a todos. Nos vemos en 2 semanas, Edgardo, si Dios quiere. Okay. Buenas noches a todos.
Buenas noches.
Bye bye.